Hey everybody, I'm Dr. Seiler from Seiler Skin, and I've got Lino, one of my staff, with me today, and we're going to show you guys just a quick little video of a little bit of filler in her lips. She's done just a little bit of filler under her eyes and her lips one time before, and she's going to tell you why she wants to do this. But this is a great example of where we can do a conservative lip augmentation in a patient that has kind of small lips to begin with and not make her look overdone with one of our thinner fillers called Velour. So why don't you tell me what you told me a minute ago about what you want to do.
Yeah, so just a little bit of volume on the outer parts of my lip, and then when I smile, you can kind of see the outer parts of my lip kind of disappear a little bit, so just want a little extra volume.
Yeah, I think y'all will see easily in this video that we can do this without any anesthesia. She'll tolerate it great, and we'll have a nice little result afterwards. So we're going to start on the lateral corner of our upper lip here. Done our little alcohol wipe. Kayla's going to show me with our cool little AccuVein here to see where the little blood vessels are. This really helps to keep me safe so I don't hurt a blood vessel and so I don't bruise them. So you're going to see me do this little wiggle here. My first little stick, she'll barely even feel because I do that little distraction technique. I'm going to aspirate just a little bit as I go to make sure I'm not in a vessel. I'm going to do a little bitty injection here, and this does have a little bit of lidocaine in it, so she'll start to get numb pretty quick. Doing okay? Mm-hmm. She tolerates this like a champ. All we did in her was ice a little bit. We haven't had to use any topical or dental block. You can see that that kind of pops the corner of the lip out just a little bit. This is one of my favorite fillers to use because it's so nice and thin. This is Velour. It's a really nice and thin HA filler. All right, let's do this side right here. We're already kind of where we ice, so she still should be pretty numb from that. And now the lidocaine, you feel the lidocaine kicking in a little bit? Mm-hmm. See, I'm going to aspirate a little bit more here. I just kind of follow the vermilion border. We're not trying to give her, you know, a ton of pulp or volume to the lip. We're really just trying to kind of accentuate her vermilion border so she shows what she has a little bit better. And I'm pretty aggressively massaging this into the tissue, which is nice about how soft this filler is. All right, let's ice the lower corner of the lip just for a second. We are going to do just a little bit on the lower lip to give her a little bit better projection. All right, let's take a look right there. All right, good. So she really doesn't have any little bitty vessels running the vermilion border of her lower lip, so we're nice and safe there. And you can see if you just kind of put the needle right at the skin and just kind of pop the skin onto it, they don't usually really feel it. Aspirate just a little bit, and again I'm just going to kind of line this lip a little bit. Each time I inject, I'm putting maybe a tenth or less of a cc, sometimes half of a tenth. Okay? Mm-hmm. Right, let's look again right there. Okay. So you can see that for y'all, those of y'all that are potential patients, you can see that she's tolerating this really well. If you're watching for training purposes, you can see how easily this is done if you really know the anatomy to do this without hurting the patient and give them a nice little bit of lip augmentation. So we've kind of brought this corner up real good. Now we need to work on the middle third of the lip. So Kayla's going to ice a little bit more. By now, since we've done 2 injections in her upper lip, the lidocaine from the actual filler itself. One thing I think that's really important to stress is that I know we always clean properly before we do any filler treatment, but you'll notice that we alcohol wipe a lot before I actually do my injections to make sure we're not injecting any bacteria into the tissue. I think a lot of times providers don't pay attention to that as much as they should. And so I'm going to aspirate just a little bit. Now we're going to kind of pop up the middle third of her lip. Right like that. Give her a nice little perk. Let your mouth just kind of hang open. Probably getting good and numb now. Mm-hmm. Not hurting that? Mm-mm. Good. And like I said, I mean, people really tolerate this well without much. We're going to hold a little pressure for a second, so we'll stop and come back on.